snored horribly loud, and that's what started me into the whole, I guess, progress of trying to get something fixed. That was the whole original issue, because I've always done it, and it's, as I got older, then it became an actual issue that I wanted to get fixed.
Jeff came to see me. He was in college at the time, and he was having severe, sleepiness. And to the point he wasn't even doing well in school. And then we did an exam together, and I noticed he actually had some nasal obstruction, and then he had some big tonsils, and that's a great patient to operate on, because tonsils are an easy way to make space. They're big, you don't really need them, and if they're in the way, they're easy to get out of the way.
Found out that I had all these other sleep issues. It wasn't just me snoring. Dr. Ludwick laid out a treatment plan, and I ended up having a surgery to fix deviated septum and to kind of adjust my palate to allow more air to flow.
For him, we just did a surgery to improve his nasal breathing. I fixed his septum and made his turbinate smaller. And then we took out his tonsils, and I trimmed his palate, made his palate smaller.
The very first night I woke up, and I told my mom, I said, I didn't know you were supposed to feel this good when you woke up, because I'd always been cranky and irritable, and it was just a nightmare to deal with in the mornings.
And it ended up curing him. It was phenomenal. He had just a phenomenal result from that. And that really brings home the point that it's not the severity that tells you where the problem is, it's the anatomy that tells you where the problem is. The severity just tells you how much that area is giving you a problem. I
was just kind of an average student, you're stereotypical, what you'd think of as a high school student going into college, things like that, falling asleep, not paying attention kind of thing. And once I had the surgery done, it was night and day. I had all this different energy, I was a completely different person. Grades started improving.
There's lots of different treatment options. There's surgical ways to treat sleep apnea, there's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status.
If I hadn't had this surgery, my quality of life wouldn't have improved to the point that it is now. Just completely different from before I had it to after I had it.